I don't know if you remember one of my favorite patients here from the East Coast who did a nice video about a year ago. We did a lip reduction. Actually, incision is healed really well. Open your mouth a little bit. You can't even see it. It's literally not there. She has actually asked me to do a video before the start of this procedure, and so I felt comfortable going in and film it beforehand. I always mention this ethically, I think it's wrong to ask a patient before a procedure to ask if they want to do a video. So I did not ask her, she asked me, so that's why we're filming beforehand. She's had some eyelid work on the upper eyelid, and it's taken away a lot of the shape of her eye. And again, I didn't see her before, so it could have been just the way she was born. But we're going to give a little bit more convexity back here. It's going to give a really soft, feminine look to her face. The lower eyelid tear trough sort of bothers her, but the thing that I want to convey is that there's a color issue that's not going to be completely corrected. But we're going to take some of the depression away and some of the shadow effect. She's got a full lower cheek, and so what I'm trying to do is create a little bit more of an upper cheek highlight and blend a little bit out here to create a cheek highlight here, but very, very little. She has a nice structure here. The nose she was a little bothered by in terms of the size, but I really think that, or the structure of the base of the nose, maybe she can articulate that better than I can. What we're going to do is blend the cheek into the nose to create a better harmony there. And there's the lower lip, she had that lip reduction. There was a mucus seal that we're actually going to work on today as well. That's something I did not create, but I'm going to try to fix as well today. And I did decompress it a year ago, so it's a lot better. And then we're going to work a little bit of anterior chin to create a nice highlight. Very feminine look. It's a very pretty look. It's a softer look, and I think she's going to be very happy. We're just a few minutes out of the procedure, and we just saw the mirror. And how's everything look to you?
Oh my gosh, beautiful. I can't believe it. I feel a little puffier,
Yes.
but looking in the mirror, like, it feels a lot worse than it looks.
Yeah, it's full. Did you see the fine print that I do need about 5% on the modeling contract? I'm sorry, it's only a 5%.
I don't think I signed that part.
You sure? It's on video right now. We better check that out. Okay.
Hi, I had full facial fat grafting today at Dr. Lamb's office. I'm about 8 hours out of surgery. I feel great. A little bit of discomfort, and I've been able to take care of that with just extra strength Tylenol. I do have some swelling, not much at all. I have been using my ice packs, and I think that's helped significantly. The discomfort, like I said, is very little. I actually have a worse time with the sore throat than much of the pain that I'm feeling from the procedure. Alrighty, that's it. I'll move the camera around. That way you can see. Now I had the fat placed in 3 places, so above the eyes to bring my eyes down, in the cheek area and in the chin for balance. Okay, I'll record tomorrow, that way you can see my progress. Thank you. Hi, this is my post-op day 2 after full facial fat transfer with Dr. Lamb. I didn't put any makeup on today. I kind of wanted you to be able to see how minimal the bruising is and the swelling. I didn't have this initially, but late last night I started to get a little bit of bruising under the left eye. Nothing under the right. Still getting by with just extra strength Tylenol. And I think the results are great. I'll record again tomorrow. This is actually my 3rd day in Dallas. So I came in on Tuesday for my pre-op visit, and then I had the procedure yesterday, and this is my 3rd day here, but 2nd day post-op. Go around so you can see. You can see I have very tiny, where he inserted the fat, they're like the size of a pin head on either side of my eye, the cheek area, and the chin. Alright, thank you. I'm recording this again. I made an error before, and I said this was my second day post-op when actually I am 1 day post-op. It's been 24 hours now. Alrighty. Thanks. Just wanted to make that correction. Okay, bye. Okay, I'm just about 48 hours, 2 days after my fat transfer. I'm just so pleased with the results. I do have a little bit of swelling. I had that black and blue area under the left eye yesterday, and that's covered up with a little bit of makeup. Very little. But I feel great, and I think it looks fantastic. Alright. I actually head back home today. I'll be leaving Dallas today. Okay.